Welcome to the Am I Mental podcast, where we explore the intersection of mental health, ethics, and the law. Today's episode is part of the Doctors in Court edition, where I take you through real-life cases where medical professionals are called to defend their decisions in court. Dr. Fonderson, and in this episode, we'll dive into a case involving a psychiatrist accused of negligence for prescribing an off-label medication to a patient with severe anxiety and suicidal tendencies. We'll examine the timeline of events, break down the psychiatrist's defense, discuss the disciplinary board's decision, and explain some medical terms like off-label prescribing. Stick around to the end, where I'll pose 2 key questions for you to reflect on, and I'll provide my thoughts on them as well. Our case involves a psychiatrist and a patient who had been under the psychiatrist's care for over 2 years. The patient had been referred to a mental health institution and treated by the psychiatrist's team after experiencing severe anxiety, paranoia, and suicidal tendencies. The treatment included medication management, and much of the patient's care was overseen by the psychiatric nurses, while the psychiatrist handled medication adjustments. In January of 2018, the patient's condition worsened, particularly in the lead-up to a court case he was involved in. He was experiencing intense anxiety, sleep disturbances, and a spike in suicidal ideation. During this time, the patient's psychiatrist decided to prescribe quetiapine, a medication that is generally used as an antipsychotic but was prescribed here at a low dose to help the patient sleep and alleviate anxiety. This is known as off-label use, a practice where a drug is used for a purpose different from the one it's officially approved for. The crux of this case lies in the patient's claim that the medication contributed to worsening suicidal thoughts and ultimately led to 2 suicide attempts. Here's a closer look at the key events that led to the complaint being filed against the psychiatrist. January 2018. The patient's condition worsens as he faces a pending court case. He reports an increase in anxiety and sleep problems. He is also experiencing suicidal thoughts, which he attributes partially to the stress of the legal situation. He is also experiencing suicidal thoughts, which he attributes partly to the stress of the legal situation. 30th of January 2018. The psychiatrist prescribes quetiapine off-label at a low dose, 25 to 50 milligrams, to help the patient with his sleep disturbances and anxiety. This was done after consulting with the patient, who initially resisted taking any new medication. On February 4th and February 16th of 2018, the patient makes 2 suicide attempts, which he later claims were linked to the use of quetiapine. He also begins experiencing nightmares and other distressing factors while He also begins experiencing nightmares and other distressing symptoms while on the medication. 2016. On February 16, 2018, the psychiatrist renews the prescription of quetiapine, believing that it is helping the patient sleep better despite his continued distress. And according to the psychiatrist, his patient reported improved sleep at times while on the medication. In March of 2018, after a 3rd suicide attempt, the patient stops taking the medication on the advice of his brother, who suggested that quetiapine might be making his condition worse. September 2018, the patient files a complaint against a psychiatrist, accusing her of negligence for prescribing quetiapine off-label and not adequately warning him about its potential side effects, which he believes contributed to his suicide attempts. Let's take a look at how the psychiatrist defended her actions in response to the accusation. Off-label prescribing. The psychiatrist explained that prescribing quetiapine off-label in low doses is a common practice to help with sleep and anxiety, especially in cases where patients have not responded well to other medications. The decision to prescribe quetiapine was made in consultation with the patient and after considering other options. Informed consent. The psychiatrist argued that she had informed the patient about the medication's purpose and potential side effects. The patient was aware that quetiapine is primarily an antipsychotic but was being used off-label for its sedative. The patient was aware that quetiapine is primarily an antipsychotic drug, but was being used off-label for its sedative properties. The psychiatric team frequently discussed the medication with the patient, and notes from his medical records reflect that he acknowledged these conversations. Patient's mental state. The psychiatrist highlighted that the patient had a history of severe anxiety, paranoia, and suicidal ideation even before being prescribed quetiapine. The psychiatrist made it clear that the patient's suicidal tendencies predated the introduction of quetiapine and that the medication likely did not worsen his condition. In fact, the patient reported periods of improved sleep while on the drug, which supports the psychiatrist's decision to continue prescribing it. Monitoring and adjustment. Throughout the treatment, the patient's condition was clearly monitoring and adjustments. Throughout the treatment, the patient's condition was closely monitored, with frequent consultations between him and the psychiatric team. Adjustments to his medication were made based on his feedback, and other interventions were attempted to manage his anxiety and suicidal thoughts. Now let's break down how the disciplinary board approached this case. Number 1. Off-label use. The board acknowledged that prescribing medications off-label is a common practice in psychiatry, particularly when the risks are low and the potential benefits are significant. They determined that the psychiatrist's decision to prescribe quetiapine was reasonable given that the patient had severe anxiety and was responding poorly to other treatments. There was no indication that this off-label use was reckless or inappropriate. Number 2. Informed consent. The board found that the patient had been adequately informed about the off-label use of quetiapine. Medical records indicated that the patient had been told about the drug's intended purpose and potential side effects. The board did not find evidence to support the patient's claim that he had been kept in the dark about the medication's risk. 3. Linked to suicide attempts. One of the most contentious points was whether quetiapine had contributed to the patient's suicide attempts. The board ruled that there was no compelling evidence that the medication had exacerbated the patient's suicidal thoughts. Given the patient's long-standing history of suicidal ideation, the board concluded that his condition was likely the result of underlying mental health issues rather than the medication itself. Number 4. The final decision. The board declared the complaint unfounded and cleared the psychiatrist of any wrongdoing. They noted that the psychiatrist had acted within the boundaries of acceptable medical practice and had provided adequate care to the patient throughout the treatment process. Let's take a moment to explain a couple of key terms that played a significant role in this case. Off-label prescribing. This is when a medication is used for a purpose other than what it was originally approved for. In psychiatry, it's not uncommon for medications like quetiapine, which is primarily used as an antipsychotic drug, to be prescribed at low doses for conditions like anxiety or insomnia. Informed consent. This is the process by which a healthcare provider informs a patient about the benefits, the risks, and alternatives of a treatment, allowing the patient to make an informed decision about whether to proceed. In this case, the psychiatrist argued that the patient had been fully informed about the off-label use of quetiapine. This case shines a light on the complexities of psychiatric care, particularly when it comes to using medications off-label to address severe mental health issues. The psychiatrist in this case faced difficult decisions while trying to help a patient with a history of anxiety and suicidal tendencies. Ultimately, the disciplinary board ruled in her favor, but the case raises important questions about how medications are used and the responsibilities of the healthcare providers. Before we close, here are 2 questions to think about. Number 1, how should healthcare providers balance the potential benefits of off-label medication use with the risks, particularly in vulnerable patients? Well, providers must carefully weigh the risks and benefits based on the patient's history and current condition. Off-label use can be effective when traditional treatments fail, but it requires thorough communication and monitoring to ensure the patient's safety. Number 2, what role should patient education and consent play when prescribing medications off-label use? Informed consent is crucial. Patients should be fully aware of why medication is being prescribed, its potential side effects, and any alternative treatments. This ensures that they can make a decision based on a clear understanding of the risks and benefits. Thank you for joining me today on this deep dive into the complexities of psychiatric care and medical responsibility. If you found this discussion insightful, please share this episode and subscribe to MI Mental for more cases like this one. Until next time, take care.